everyone. I'm in a little different location today. I'm here in my car because I'm heading into an appointment right after we finish today. But I really wanted to get on and just do this every single week. I love doing this. While we wait for questions and things to come today, I would love to share a little bit about what I've been studying and researching lately. So, as you know, what I'm currently doing is writing a book. I am writing a book called Well. And in this book, I'm talking about the way our bodies work. And I've just created this model called the well cell. Basically, what does a cell take to be well? And really, what I've learned is that if you can help one cell be well, you can help every single cell in your bodies be well. So as I've been studying this, I've been studying the background of what's called cell science. And there are a lot of people who have studied cells and equated them to things like machines. So we have a lot of terminology in science saying things like, the outside of the cell has pumps and ports and all of these different words that are like a machine. So that makes us think, okay, where our bodies must work like a machine. We must be programmed in a certain way. And if everything, all the machinery must work right. So if we don't work right, then it must be a problem with the machinery. Well, I'm going to challenge that. I'm going to challenge that in the book. I'm going to challenge that with you right now. I want to say that our bodies work a lot more like a cell phone does. So let's think about your cell phone. If you are switching from your texting app to the music app, do you have to open up the back of the phone, get your screwdriver out, your, micro soldering iron, and change the circuit board? No, of course not. You just have to push a button. And the programming or the software, the electronic communication, so that button push sends an electric signal to another thing in the computer that then changes the screen on our phone. Okay? This says this without us even thinking about it. Same thing actually happens in our cells. We don't actually have to go in and change the hardware. We don't have to change a part or a piece of our bodies in order to change the way that our bodies are working. And we know this because we make, New Year's Eve resolutions where we say, okay, I'm going to exercise and I'm going to eat right and I'm going to do all this because we believe that we can change the way that our cells function. And it's true. I was studying something fascinating. I'm going to be teaching in the book about how nature communicates and how we can actually replicate some of that communication in our own cells and how we can learn from it. So I was learning about a tree in Africa called the acacia tree. And the acacia tree is in the sub-Saharan Africa, very dry, very hot. It can survive without on only 4 centimeters of rain a year, which is crazy. It can survive up to 120 degrees during the day and freezing at night. It's so resilient. And one of the things that it's done to be resilient is it has this really overarching umbrella of leaves, very small leaves that don't dry out, but also very small leaves that collect the sun and create photosynthesis and create food for the tree. Well, the only animal that actually can eat this tree is the giraffe. All the other animals are deterred because it has two sets of thorns, really long thorns and kind of spirally thorns. Well, they're really vicious, so not a lot of animals can't eat it. Well, what the tree has done, it's pretty crazy. What the tree has done is it's figured out that when a giraffe eats one of its leaves, it sends this chemical messenger out to all the rest of the trees in the area through something called ethylene gas, and you could smell it. All the other trees sense this ethylene gas in the area and they start making their leaves very, very bitter. If the giraffe eats too much of this bitter leaf, it will make it sick and it'll sometimes even lead to death. So giraffes don't eat the leaves from the trees that have signaled each other. So what have the giraffes figured out to do? They figured out that they actually should only be upwind when they're eating an acacia tree. Because if they're downwind, all the trees downwind are going to smell the gas. Everything upwind hasn't gotten the gas yet. So the giraffes are super intelligent about this as well. Not only that, but they'll often hop 100 feet, 100 feet, 100 feet to basically the distance the ethylene gas will travel. This is the way nature works. It has all of these chemical and electronic messages that it sends to each other to keep things working right, and our cells do the same. Now, that's the cool part about dentistry is there's so much in dentistry that affects that electronic signal that our body sends to help keep our cells well. One of the big ones is metals. So metals will conduct electricity. We know this, right? This is why we don't want to, why we don't put a hot pan or put a pan in a microwave, because it will conduct that electricity. And we know that all of the wiring in our homes is all metal wiring. That's what conducts the electricity. So if you have metals in your mouth, whether it be a crown, whether it be a mercury filling, it's going to conduct electricity, and it's going to throw off the way the electricity works in your body. So really fascinating. Sorry, I'm making sure that we got people on here that we want on here. So let's start working on some questions for you. If an adult has signs of oral ties or some occlusion issues causing sleep apnea and other problems, what is the first way to go about treating? So if an adult has oral ties, what does that mean? That means a tongue tie. That means, I'm going to have to click on and off of this. I'm on the phone. That means a tongue tie. That means a lip tie. If you have those kinds of things, the question is, or even bite issues that's causing or leading to sleep apnea, what's the first way to go about treatment? So let's first of all talk about how can those things relate? How can those oral ties, lip ties, tongue ties, how can they relate to sleep apnea? Well, it's going to go clear back to when you very first started to develop. So literally, embryonically, before you were even born. We all have different things. Again, talking about cells and communication, there's a lot of communication going on in that baby as they're developing, saying, grow this here, grow this there. As soon as the baby is born, what happens is that first instinct is to feed, right? We want to suck. And sucking on a bottle, a nipple, whatever it might be in the mouth, tongue against that thing, bottle or nipple, against the roof of the mouth is what creates that suction and that suck. Well, it does other things as well. That pressure of the tongue against that nipple or bottle also creates the roof of the mouth. And if the tongue can't go there, then the roof of the mouth forms very, very narrow. Why does this have anything to do with tongue ties? Often the tongue tie is the reason that the tongue can't go there. So if the tongue is tied down, instead of being able to push the bottle or nipple up, it has to come out here, and the latch is very altered. The latch is very forward because the tongue can't push all the way to the roof of the mouth. So the tongue tie leads to an altered suck pattern, which leads to a very small mouth. Once you have a very small mouth, now there's not enough room for tissue at the back of the throat, for the tongue, and this then crowds its way into the airway or into the tube that you're supposed to be breathing through. If all of this is crowding into the tube that you're supposed to be breathing through, there's not enough room for air to pass, and this is often leading to sleep apnea problems. So what do you do first? Well, first of all, we want to figure out, is there a tongue tie? If so, then we always start to work and train that tongue first. If we just go in and release the tongue tie, we can do it with a laser, but if we just go do that, your tongue's not going to have a clue what to do. It's never been able to. So we do what's called myofunctional exercises. We do this first. It all can be done virtually through Zoom. We train your tongue what to do. You do these exercises at home. Once the tongue is capable of doing certain things, we then clip the tongue tie. That's the next thing. So tongue tie is next after training the tongue what to do. Once the tongue tie is released, the tongue knows what to do. If the apnea is resolved, then we're good to go. If not, then we look and say, do we need to actually make the mouth bigger again now? And we have a lot of different ways to do that, depending on your lifestyle and what you're able to tolerate in your mouth with expansion. But at any adult, any age, we're able to make more room for the tongue, and that will then correct sleep apnea issues. It's kind of interesting how all these things tie together from day one all the way to you maybe struggling with air right now. So we just work our way backward. If it was the tongue tie that caused the problem, let's retrain the tongue, let's clip the tie, then let's make more room. Okay, next question. My son's orthodontist recommended him getting his large tonsils out due to him snoring. Is there another option? What causes tonsil to get so large? I love this question. And here's the interesting thing. We've been learning from a specialist. His name is Dr. Kevin Goles in Colorado Springs, and he is pretty much the world premier specialist in sleep and airway development for kids and adults alike. And we have every Thursday morning, I have an hour-long call with him. It's phenomenal, the things that I just soak in. He's talked extensively about this and said that when expansion is done, when there's more room in the back of the throat, then he has like 80 to 90% of kids that have been told you need your tonsils out. The expansion makes enough room for the tonsils to fit, and they don't actually have to get tonsils out. So it's pretty amazing. Talk to that orthodontist about expanding and making more room. The second thing I recommend is talking to somebody that will do, it's called NAET. I pronounce it as NAET. What it is it's an allergy elimination technique. And with that technique, they'll identify what food or environmental allergen may actually be causing those tonsils to get so swollen. Address that, make more room for them to fit, don't have to get tonsils out, which is huge because tonsils are your lymphatic system for the head and neck, and I'd really like them to stay put if possible. So expansion, Get some allergy work done, and then see if they need to come out. But don't just do it right off the bat. Should I wait until my 7-year-old first front teeth grow in prior to doing palate expansion? We're just talking about this again this morning. So ideally, you want to wait until they have their 6-year-old molars in. That's the guidance, because we use those 6-year-old molars to anchor expansion. And usually once we have those 6-year-old molars in, we can expand to the width we need. So that's the guiding landmark, is when are those 6-year-old molars in? When they're in and ready to go, then we can do expansion. Is it safe to remove amalgam fillings while breastfeeding? Actually, I do not recommend removing amalgam fillings while breastfeeding. And the reason is this mercury does transfer through the placenta. It also transfers through breast milk. And there was a brand new study that just barely came out, literally like a month and a half ago, talking about this and showing and proving this, that there were higher levels of blood or urine mercury levels in children and in mamas, both pregnant mamas and their babies, that had mercury amalgam fillings in their mouth. So I do not recommend it. You are going to get a little bit of that mercury into your baby, even because those fillings are in your mouth, but you're going to get a much higher level if you remove the filling and release a lot of mercury. So wait till you're done nursing and then get them out. And it is worth it. How do you know when a baby tooth is starting to remineralize? What to look for? All right, so some of the signs for a baby tooth that are starting to remineralize is white. They start to get kind of a white edge right at the remineralizing or the demineralizing area. So maybe I'm answering this question wrong. Baby tooth is starting to remineralize. All right. So let's talk about demineralizing first. So the demineralizing looks like a white band around the tooth. So the remineralizing, if the remineralizing powder is helping and working and getting into the tooth, we'll see that white band start to disappear and start to get very chalky, very hard surface. It's not, a lot of times when it's demineralizing, it's almost flaky. You can almost kind of flake off that white stuff. It'll get very, very hard when it remineralizes. So that's some of the things you're going to be looking for. What are your thoughts on xylitol baby teeth wipes? Interesting. I've never even heard of xylitol baby teeth wipes. So let's talk about what xylitol does, and then you can make your own decision on this one. Xylitol actually cannot be consumed by bacteria. They can't eat it for fuel. So if you're having something that's sweetened by xylitol, it does not fuel the bacteria in your mouth. It also can't be eaten by bacteria in your gut. It kind of slows a lot of things down. You don't want to eat a lot of it because it does throw off gut function. But from a mouth standpoint, it actually is anti-cavity, so it's wonderful. That's why they're using it in a wipe, I'm guessing, is because it's going to give a layer that basically the body can't use, the bacteria in the mouth can't use. Why do you need it in a baby? That's my next question, is why do you need it in a baby? Is there a lot of tooth decay going on in a baby? I think a xylitol wipe after nursing, after bottle feeding, after something like that would be a fabulous idea, because you're wiping the teeth off, but then you're also depositing a layer that can't turn into a cavity, that can't be eaten by bacteria and won't lead to a cavity. So I don't know much about it, but it seems like a good idea. Is the gelatin and hydrochloride supplements, is it pork or beef? I actually don't know the answer to that either. I just know it's gelatin, so I will find an answer to that one. Good question. After the infection removal, can the tissue at the back of the airway shrink? Yes, and that is the reason that we recommend that. So what this questioner is asking is, when we remove infection, so if there is infection in the back of the mouth where wisdom teeth were removed, if there's an infected root canal, if there's gum infection, as that is resolved, does that decrease the size of the tissue in the back of the throat? The answer is yes, because it's just like anything that's inflammatory. And if you have a swollen finger because you hit it accidentally, or because you cut it, or whatever it might be, if it's red and swollen, when that infection goes away, what happens? The swelling does as well. The swelling is the result of your body's reaction to the insult. So when the infection is there, the body is reacting and it's creating swelling and inflammation. Once the infection's gone, swelling and inflammation goes away. I'm having a tooth pulled that has a metal filling. Any health concerns with this? No. And actually, as long as the only health concern with removing a tooth that has a metal filling in it is if they have to cut through that metal filling when removing the tooth. So I would just ask the surgeon and just say, can you please not cut through that filling? When cutting through that filling, it's going to release some of that mercury. So if they have to divide the tooth, sometimes the tooth doesn't come out whole. In fact, often it's less traumatic to remove a tooth in pieces than it is to remove it whole. So just ask them to please not cut through that filling if possible, so it doesn't release the mercury. My son has a metal cap. He's 5. Due to a cavity and the tooth was chipped. How can I help support? Okay, so get this question a lot about kiddos and metal crowns and kids. Um, the metal crown that is used in children does not have mercury in it, so you can let yourself off of the hook a little bit on that one. It doesn't have mercury in it. It's going to be a stainless steel crown. And that metal does conduct electricity, so it does have the problems of that, but it does not have the problems of mercury. It is very inert, meaning it's not going to create as much problem in the body as a mercury filling would. So a metal crown on a baby tooth is also temporary. It's going to go away when that baby tooth comes out. You're just going to want to support his immune system, make sure that tooth stays healthy, watch it closely. If you see any sort of redness around the edge of that crown, go see the dentist immediately because we want to make sure that tooth's not abscessing. That's the main thing to do. All right. What questions do is metal filling the same as amalgam filling? How do I know if my filling has mercury in it? This is a great question. Every single filling that you are going to call a silver filling is 50% mercury. The only other kind of fillings there are gold. So you'll know it's gold because it's bright yellow, or composite, which you're going to know is because it's white. So if it's white or bright yellow, it doesn't have mercury. Anything else is 50% mercury. Good question. How do you treat H. pylori in the mouth? Interesting, oftentimes H. pylori, the source of it in the gut is the mouth. So we're going to treat bacteria. We're just going to kill bacteria. My favorite thing is my mouth rinse, and I made it for this reason. It's broad spectrum, meaning it's going to kill whatever bugs you have. So mouth rinse twice a day. You can also oil pull once a day, and that's going to help balance those bacteria in your mouth. What kind of questions should I ask an oral surgeon in regards to moving kiddos' wisdom teeth? I want to ensure best caring practices. First question is, do they need them out? I just saw a young girl yesterday, a 19-year-old girl, and I told her, no, we're going to leave those wisdom teeth there right now. The key is how much room is in the mouth. She had plenty of room for the teeth to come in. They do not need to come out if there's room for them. So that's the first question. Second is, we want to make sure that the ligament is removed. And then in our office, we use ozone to make sure there's no infection in the site, and we place what's called PRF, which is stem cells in the area. Are you going to be able to find ozone and PRF routinely? No. Unfortunately, no. You're not going to be able to find that. Maybe PRF more than ozone. So that's the main thing you want to focus on, is make sure that the ligament is removed. They'll probably roll their eyes at you and just say, just make sure for me that this happens. And if we could throw some PRF and there's some stem cells, that would be even better. Not routinely done. So those are things to watch for. I'm having gum disease and a lot of cavities that can having gum disease and a lot of cavities contribute to gut health problems or any other health issues. Gum disease is gut disease because gums are part of the digestive tract. So if you have gum disease, you absolutely have problems in the gut as well. They're very much related to one another. Cavities is often related to gut health because it is the gut health, if you're not absorbing nutrients properly, will lead to tooth decay. There's so many correlates. So any other health issues, absolutely. Gum disease, cavities, they're pointing at a lot of problems systemically, health problems, hormone issues, blood pressure issues. So many other things are all interconnected with oral health. It's really hard to simplify into one answer. But for sure, cavities are an indicator of gut problems, and gum disease is an indicator of gut problems. So both of those things need to be addressed to really help your gut. I was told I have a small airway. I had several root canals removed, and now I have aligners that will help. Now I have aligners. Will that help my airway expand? It should help your airway expand. The key is making sure that whomever is doing that aligner therapy is very much intentionally expanding. So that's something to ask the orthodontist or the dentist that's doing that treatment is, are you working to expand my mouth while you're doing this aligner therapy? And hopefully the answer is yes. Make sure they're doing that. When should I see results on baby tooth remineralizing? How many weeks and months after starting with the powder? We'll often see results about a month in. So 4 weeks in, 1 month in, we'll start to see that things are hardening up again. They're not nearly as chalky, and they're starting to harden. We typically say 3 months is, how long it takes to remineralize something, but you should see results starting at 1. Do we have a protocol to a toddler that has front teeth that are demineralizing? Absolutely. So the question for front teeth demineralizing on a toddler is, you're going to use the tooth powder, whichever one they'll like. A lot of times kids like the citrus flavor. So you're going to brush with it. Then you're going to rinse, and they'll usually like a toddler. I usually like the the mouth rinse. You don't have to worry about them swallowing this kind. It doesn't have alcohol in it, so it's no problem that way. In fact, if they swallow it, it's just going to help their gut function a little bit better. So brush with the tooth powder, rinse with the mouth rinse, and then you're going to get a little bit more tooth powder, mix it with water, make a paste, and put it right on the demineralizing areas. A month of that, and then go to bed. This is right before you go to bed. Then go to bed. So it just sits on there. A month of that, you're going to see it's changing. My kids never used to have cavities. What makes the biggest impact for a sudden change within a year? This is a good question. The biggest change within a year is going to be three things potentially. Number one, your water source. Are you using a different water source right now? Sometimes people will say, well, yeah, I just got a reverse osmosis system on my entire water system. I thought it was great. And I'm going to tell you, I have a reverse osmosis system as well. And there are a lot of benefits in that it's very clean water. But the problem with ultra clean water is it's what we term hungry water. And it actually will go and steal minerals from your teeth to balance itself. This is a little crazy. This is the same with alkaline water. It will take minerals from your teeth to help balance itself. So if you've just switched to an RO, reverse osmosis, or an alkaline water system, the key you need to know is you've got to add minerals back to that water if you're using it when you're drinking or making food or anything like that. You need to add minerals back in. Otherwise, that water will steal minerals from you. So why do we use it? For the cleanliness of the water. That's why. But what I do is I actually add minerals and salt back into it and a pitcher on my countertop, and that's what we all use to drink. That's what I used to cook with. This is a little bit of a misnomer. I have seen people that have gone from no cavities to 10 cavities in 6 months' time, and I basically pepper them. What have you done? What have you done? What have you done? And more frequently than not, it's their water source that's changed. It's their water source. People don't realize this. They think RO and alkaline are fabulous. The other problem with RO and alkaline, particularly alkaline, is that it alkalizes the stomach. Well, when you alkalize the stomach, what happens is that the stomach can no longer absorb nutrients the same way. You cannot drink alkaline water along with food. So you have to drink it away from food, at least 30 minutes on both sides of your meal. So if you have alkaline water and you're drinking that with every meal, you aren't digesting the food that you're eating with that alkaline water. It literally is making it so you're not digesting it. So you've got to make sure that you're remineralizing that alkaline water, or just drinking mineral water along with your meal, not alkaline water with your meal. The second one is food.